Alright, in the previous videos we've looked at the social construction of health and some key terminology within the sociology of medicine. In this video we're going to be looking at the social determinants of health. What we're thinking about here is what factors in society and in our social lives affect how healthy and sick we are. This is a very current issue. In New York and Michigan and many hotspots of the current global pandemic of COVID-19, we're seeing some pretty strong racial disparities in the effect of the disease. So in Michigan, for example, the percent of the population that's African American is about 14%, which is pretty much the par for the course globally, nationally. However, if we look on the left here, we'll see that over 33% of cases of COVID-19 are African American, meaning that's disproportionate to the population. More African Americans are getting the disease than are represented in the population. And when we look on the right, we even see that more black folks are dying than other racial groups. So is a disease racist? The answer simply is no. We live in a racist society. So sociologists would ask, what are the social factors that affect the spread of disease and its lethality, the degree to which it kills different populations? Why do more black folks get this virus, and why are more of them dying of it than other populations? What we're thinking about here is what we call the distribution of morbidity or mortality. Morbidity meaning the spread of disease. Mortality meaning death and death rates. So distribution, we're thinking about who gets diseases and who dies more often. We can also think about really who's considered healthy and who's considered diseased and who gets to say so. So what are some of the social forces we might consider with this disease? One that's come up a great deal is social class. Many of the essential positions we've seen are staffed by lower class workers, and we know from our sections on race and class that more African Americans and Latino people work in lower class jobs. So there's greater exposure to it. But how does that explain mortality? Well, how does that explain higher death rates? Well, it does a little bit. If more people get it, then more people are going to die from it. But it also suggests that the disease is, in some populations, more lethal, that it kills certain people more. And what we're really thinking about here is that the immune system that fights off viruses isn't able to do so very well or as well in more black people in our country. And so the question again is why? What leads to this? The truth is there are a lot of social determinants of health. We can think of things like stress, for example. When your body is stressed, it releases adrenaline, which is a corticosteroid. That might not mean anything to you, but if you get an inflammation and you go to the doctor for it, they will often give you a corticosteroid because what the inflammation is your immune system responding to something, and the corticosteroid suppresses your immune system. So if adrenaline is a corticosteroid that suppresses your immune system and you're constantly under stress, then that means that your body is constantly suppressing to some degree your immune system, which means it doesn't have a strong ability to fight back. Many studies show that being black in a white supremacist society such as America is itself stress-inducing. You might go out to the store and worry about being pulled over while you go there. You worry about someone following you while you're in the store. You worry about the way people look at you if you have your child with you there. All of these things produce a kind of constant low level of stress. But we can dig even deeper than that. Over 140 years ago, Frederick Engels, who worked with Karl Marx, did a study of the conditions of the working class in England. And where we live, how we live are also very important. So for example, in the neighborhood around Payne College, which is predominantly black, we probably see higher rates of diabetes, of obesity. Um, Now, we often think about these things as being based on personal choices. You should eat better and exercise more. But if we think about some of the structural factors around Payne College, where do you go to get fresh food if you want to eat better? I know there's 3 different places that will serve you various kinds of fried chicken, but where do you go to get a fresh head of lettuce? So Payne College is in what's known as a food desert. And this is typical of many poor communities where there isn't a lot of access to healthy food. Um, so the environment you live in, chronic health issues can arise from that if you eat more fat-saturated, salty food because that's what's available. Now, if we can also think about people who are working some of these lower class jobs, often if you want to stay afloat, you have to work more than one. Or if students are, I know some of my students work and go to school. Um, there's not a lot of time to eat or prepare your own foods. So you don't have a lot of time to bust to the grocery store. So there are some social class, some geographical issues that are social determinants of health. Another interesting example of this, we tend to see higher suicide rates amongst white people than black or Hispanic groups, and even higher amongst American Indian or Alaska Native groups. What could be the social determinants here? Here's where cultural factors might be crucial. Whites are more likely to be less family dependent and less family centric than black or Hispanic groups or Asian groups, more individualistic. And so long ago, Emil Durkheim said that one of the things that can lead to higher rates of suicide among young adults is that they feel more detached from society, or they feel kind of anomie, as he called it. Maybe this is why it's particularly among men that we see higher rates of suicide. What about American Indians? What would explain that? Another key aspect is environment. Many poor neighborhoods typically have worse off physical environments. It means the air is dirtier. Often they might be located near more high polluting structures. All of this means that things, for example, coronavirus currently attacks the lungs and the breathing apparatus in the body. Well, if you're constantly exposed to more pollution in the air, then your lungs are weaker and already deteriorated, and they can't breathe as well. And if you're living in a neighborhood next to a large factory, you might have asthma. You're more likely to have asthma. Your lungs have already been weakened. So this is another thing that might help explain this higher death rate. What are some other aspects of the environment we might consider? So as we think about these different death rates for this particular disease and the higher morbidity in poor communities in general, there's a lot of complex things to consider. What are other cultural factors, things about diet and living conditions, that might inform the different impact of this global pandemic?